Language is a really important way that we can put trauma informed care into practice. The words we use to describe clients and behaviors, whether the client is hearing us at the time or not, the language that we're using ourselves or with our clients or with our colleagues can really reflect and reinforce a trauma informed environment, or it can reflect and reinforce an environment that is not trauma informed. So, for example, we can look at the language we might use to describe trauma symptoms and think about how to reframe language to be trauma informed rather than stigmatizing. We might currently talk about behavioral issues when in fact those behaviors are a result of trauma. And when a person may have experienced abuse or been manipulated or threatened or had their concerns not listened to or been deprived of basic needs, it makes sense that these responses developed as part of that person's survival strategy. So, responses to these experiences and events may be the first way that a person responds in another situation when they feel threatened or or in distress. And providers have a really important role here in how we respond to these instances and these behaviors. Learning more about trauma and trauma responses can help all of us as providers begin to recognize trauma symptoms. So, some of the ways we can adjust our language to be more trauma informed are, instead of saying someone is non compliant, is that they need more support. And instead of labeling someone as difficult or attention seeking, it may be that they have trouble communicating their needs. Instead of disruptive, they may need more time to understand information or a different approach. And rather than inappropriate behavior, it may be that they're unable to set healthy boundaries right now. We can think of behaviors as an attempt to meet a need. And when I'm working with a client, I often ask myself, what purpose is this behavior serving for this person?